Hi, today I'll be talking about Gonio Ready Lens, an innovative system that allows surgeons to operate on the irido-corneal angle with both hands. Up until now, we've been using our non-dominant hand to hold the gonioscopic lens in place. This may be a revolution in glaucoma surgery, but before that, let's get ready. First, I need to remove the resight from my Zeiss Artivo microscope. We unscrew the cap, remove the cable, then press a small button while withdrawing the panel of the resight. Then we will insert the Gonio Ready microscope support. Time to use the Gonio Ready sterile pack. Let's disinfect. This pack comes with two discs, one white one for a Zeiss microscope that I'm inserting with the protuberance side up, and we hear a click. This part remains sterile, and the blue one for a Leica microscope. Now I'm holding the Gonio Ready Lens part. I'm checking if it's right and not bent. You will see that I'm gliding using the disc, so I'm still sterile. And the support has two holes that will fit in the two protuberances from the disc in the microscope. I'm going to use my two thumbs to push it, and I hear a click and it's done. You'll see that I can turn it at 360 degrees. Now I'm going to prepare the Gonio Ready Lens in the eye. The first thing is position. I'm going to use a sterile handle to incline the microscope 30 to 45 degrees. I do prefer on the side of 45 degrees. And then I'm going to incline the patient's head far from me, at least 15 degrees. Sometimes it can be more. The second thing is to have a good focus on nasal iris under high magnification. Now that I have a good image, I'm going to decrease zoom. We'll then apply a dispersive viscoelastic on the cornea, and I will be able to lower the Gonio Ready Lens body, and we will adjust the position by swinging it. It can turn at 360 degrees, and we'll use the blue knob to move it slightly upward or downward. We can fine-tune it using the microscope pedal. Let's see some examples in which I found this lens useful. Here I'm performing a GAT, gonioscopy-assisted transluminal trabeculotomy, which is a powerful microinvasive glaucoma surgery, mixed surgery, but it can bleed, namely during surgery. I found it useful to be able to have the left hand injecting OVD, therefore decreasing the hemorrhage, while the right hand was doing either a goniotomy and later on holding the micro iris forceps to put the prolines inside the Schlemm's canal. So this was a good example of surgery in which I didn't have any bleeding thanks to being able to use both hands. Here I'm performing an eye stent, and you can see there are these tiny air bubbles that are bothering our view. So simply with the left hand, I'm injecting OVD to deplace them to be able to, with the right hand, inject the eye stents. The last example came with a surprise. You can see that the proline suture is going suprachoroidal, so I'm forced to remove the suture and to insert it back again, but the second time it also wants to go suprachoroidal, so I withdraw it and once more I insert it more anteriorly until it finally goes through the Schlemm's canal. Usually there's a huge amount of bleeding between these maneuvers, but thanks to the left hand injecting OVD, I didn't have significant bleeding. Hopefully you have everything you need to get started with Gonio Ready Lens. Let me know your thoughts on the comments below. Bye!